Morning, everyone. Thank you all for coming here today. This is the Latin American Perspectives webinar on the 2022 COVID issue called COVID-19 Coronavirus Pandemic Politics in Latin America. We're very excited to be joined today by a number of our contributing authors who are going to be presenting on their work, and it's going to be really exciting. Hopefully, we'll have a great discussion. Now, I want to introduce Dr. Christy Wilson, who is one of the co-editors with myself and Tomas Crowder on the issue, and who is also a contributing member of the editorial collective at LAP.
Thank you, Alex. Welcome, everybody. I'm just going to say a couple of words before we get started on how this pandemic issue of Latin American perspectives got started. The issue that we're going to be talking about today is volume 1, but we have a second volume coming up because we got so many submissions for our call for papers. And it started when we went on lockdown with the editorial collective at Latin American Perspectives. Previously, we had been used to meeting in person in the Southern California area for our editorial meetings, and suddenly we could not do that. So we all went on Zoom, just like a lot of people, and we started to get a lot of different information from all over the world during the confusing early stages of the pandemic. And we thought, as editors, wouldn't it be interesting if we created a blog so that people in Latin America could, in real time, report in on short, everyday stories of things that they were witnessing, either in their research lives, in their personal lives, in their communities, et cetera. And the blog went really well. We got a lot of interesting content on it, a lot of interesting discussions. And this led us to want to create this issue on COVID-19 in Latin America. And so here we are today. I'm really excited to hear from our presenters today. Volume 1 covers a range of issues from gender inequalities and gendered violence, gendered care work, work in general, telework, gig economies, shifts that occurred under COVID-19 that may or may not become permanent shifts in the way we do work. We experienced that ourselves in the collective. We now meet exclusively on Zoom, so we don't have live editorial meetings any longer, for better or worse. Weaknesses in government institutions, weakening democracies, social movements, new pandemic-inspired shock doctrines, education, missed schooling, inequities in access to Wi-Fi and technology, and so many more interesting issues have been brought up in this first volume of Latin American Perspectives and our special issue on COVID-19. So I don't want to say much more. I want to open it up so that we can hear from some of the authors in this issue who are here today coming from all over the world. So welcome. I'll turn it over to Tomas now.
Thank you, Christy. Buen día a todos. Good morning. Well, I'd like to start by asking Maxwell Cameron, Marcilia Gambata to talk about their essay. And I'm very excited to have you all here. And yeah, we'll just go around and hear from you first, and then we'll invite our students, our audience to share their thoughts about your presentations and maybe ask some questions, and we can open up the discussion. Thank you so much again, Max and Marcilia.
Well, thank you, Tomas. Really a pleasure to be with you today. I thank the journal, Latin American Perspectives, and also the editorial team. It's great to see you guys directly for the first time. Really appreciate the work you put into bringing this volume together. My name is Max Cameron. I teach in the Department of Political Science in the School of Public Policy and Global Affairs at the University of British Columbia. And today I'd like to present our paper, which is entitled A Tale of Two Crashes, Pandemic Politics in Brazil and Peru. There are, in addition to Marcilia, who will speak in a minute, and myself, Veronica Hurtado and Paulo Sosavia Garcia are co-authors on this paper. So let me just begin with a few sort of introductory remarks, and then I'll pass the floor to Marcilia. And I guess what I'd say to begin with is that we really began with an observation that now is not at all new. I think many people have realized that if we look at evidence of pandemic preparedness and then look at the actual outcome of the pandemic, we don't see much correspondence. So just the year before the pandemic began, the Global Health Security Index produced a measure of pandemic preparedness in countries all around the world. And one of the things that was really striking was that some of the countries that were deemed to be most well prepared actually performed very poorly. The United States, of course, at the top of the list among countries for pandemic preparedness, and of course, the United States did poorly relative to most other countries in the world, which obviously tells us that politics was critically important. And we saw the same in Latin America as well. In fact, we noticed, my co-authors and I, particularly Paulo and Veronica, had done some work on looking at the stringency of initial responses to the pandemic. And they made a very interesting observation that really became the point of departure for our paper, which was that it was actually the countries that were least well prepared, the countries whose healthcare systems were most fragmented, underfunded, and weak, where we saw often the most stringent responses. When you think about it, that's actually not that surprising. Because what it tells us is that there were many countries in the region that understood that if the pandemic ripped through their extraordinarily vulnerable populations, the consequences would be extremely dire. Peru is, of course, a great example of that. So we've got two cases we're looking at, Peru and Brazil. In the case of Peru, the country was clearly highly vulnerable to COVID. In the case of Brazil, Brazil had made substantial investments in its healthcare system. It had fought off, Zika, H1N1, had a community of health professionals that have been working on AIDS. They seem to be well positioned. And again, if you went back to that global health security index, Brazil was the country in Latin America that looked best prepared. And yet Brazil didn't do well either. And so I think one of the really sad lessons, unfortunately, of our paper is that early countermeasures really had little effect in terms of outcomes. Over time, it was impossible to avoid the devastating consequences of COVID in countries that had weak healthcare systems, and countries that didn't respond effectively, of course, also suffered. Peru's technocratic approach was actually hindered by the very thing that Peru's technocrats have failed to do really over the last several decades, which is to take advantage of the high rates of economic growth and invest in their public health system. And instead, they focus primarily on promoting investment and in guaranteeing macroeconomic stability, and that simply wasn't enough. So as we'll see in both Peru and Brazil, the problem largely came down to politics. In the case of Peru, lack of investment in the healthcare system. In the case of Brazil, a president, neoliberal president, Jair Bolsonaro, who really diminished, ignored or belittled the crisis. So with that, I'll turn it over to Marcilia. Marcilia can talk a bit about Brazil. We'll come back to me to say a few things about Peru, and then Marcilia can wrap up. So Marcilia, the floor is yours.
Thank you, Max. Thank you so much, everyone. Thanks to the Latin American Perspectives for organizing it. Well, my name is Marcilia Gombata. I work as a researcher at the University of São Paulo, and I also teach at FAAP, a private university here in São Paulo. So I will present the part of our work that looks at Brazil, the Brazilian case during the first wave of COVID-19. So what we saw that under the presidency of Jair Bolsonaro, our former president, Brazil became a COVID epicenter, right? So Brazil has a universal and decentralized health care system with high levels of technical expertise and also experience among the staff of the health ministry. But Bolsonaro just ignored these resources that we had. He politicized the pandemic and prioritized economic growth while blaming his opponents for what he considered costly public health measures. Bolsonaro downplayed the seriousness of the virus and fault health policy experts, and he minimized the risks of the COVID-19 and pushed for economic opening following Trump's steps like we saw in the past. So the president also fought the governor of São Paulo, João Dória, who became a national defender of the vaccination against COVID-19. And probably without Doria's insistence on the vaccine partnership with China, Brazil would have its immunization campaign delayed. And also the partial autonomy of the Brazilian health system, the SUS, in which the decision-making authority is shared among federal, state, and local levels of government, enhanced Brazil's police response in anti-Bolsonaro states here. So after firing two health ministers, Luiz Mandetta and Nelson Teich, both physicians, Bolsonaro installed an army general in health ministry, Eduardo Pazuello. And it's worth noting that in addition to rejecting scientific and technical advice, Bolsonaro appointed a parallel advisory body, which met between 2020 and 2021 to provide the alternative advice that he wanted, like the use of the hydroxychloroquine. And and what we see is that the pro-Bolsonaro states followed the president, adopting early treatment policies and avoiding lockdowns. And is not a surprise, but in the areas and the municipalities where Bolsonaro did well during the 2018 election, the rate of infection was higher. Furthermore, Bolsonaro undermined vaccination efforts, putting significant obstacles to the vaccination program. The Brazilian National Immunization Program is very well consolidated and well structured, and has helped prevent many epidemics in the last 4 decades. And despite this, his chaotic approach, Bolsonaro retained the support of a third of the voters regarding the management of the pandemic. So I turn the floor to Max.
Thanks, Marcilia. So in the case of Peru, the policy response initially was highly stringent, and there are a number of reasons for that. One is the president, Pedro Pablo Kuczynski, had just been impeached and replaced by his vice president, Martin Vizcarra, who in turn dissolved the Congress. And so at the moment that the pandemic hit, the Congress had yet, in fact, to be sworn in. So there was Vizcarra was in a very strong position. And to his credit, he, or rather his Minister of Finance, and by the way, not the Minister of Health, recognized the severity of the problem and put in place extreme measures to try to prevent the spread of the virus. People were told to stay home, and the military patrolled the streets. So you had lockdown, you had travel bans, you had work from home orders, limits to social gatherings. And the interesting thing to me is that the government was confident that it was in a strong macroeconomic position. It could spend the resources necessary to try to get through this and to use these measures to prevent the spread of the pandemic. And I think what the technocrats really failed to understand was that sooner or later the contagion would spread. And the most important line of defense would be, of course, the healthcare system, which in fact was extremely weak. The reality is it turned out to be very tough to lock down a country like Peru, where 70% of the population is in the informal economy. They can't work from home. They don't have bank accounts. So if you give them checks to supplement their income, they're going to be lining up in front of banks and spreading the disease that way. They don't, in many cases, many people don't have refrigeration. And so they go to markets on a regular basis. Those markets are crowded and vectors for the spread of the disease. Many people don't have running water in their homes, so you can't tell them to wash their hands with soap. There were mass migrations as people moved back to the countryside, where at least they would have food and other supports. And again, that took the disease with them throughout the country. So you get, in fact, an explosive growth of contagion, notwithstanding these stringent measures. And then that hits the healthcare system, which is massively fragmented, underfunded, uncoordinated, and effectively corrupt. You've got a Ministry of Health and you've got a health social security system, but it's highly fragmented. So there's a central health system, but there are 25 regional governments. They all have their own health directorates. The army, the police, the private sector, and religious groups have their own healthcare systems, and most Peruvians don't have access to primary care. So you've got a highly underfunded system, and there's of course a huge amount of corruption. Basically, everything that the Peruvian healthcare system needs, it purchases from abroad, and the procurement process is deeply corrupt. One example of corruption is that prior to the pandemic, a couple of international companies that controlled local firms in Peru that produced oxygen actually lobbied and bribed the government to increase the purity levels of oxygen that were required to produce oxygen in Peru well above international standards to drive out competition. So when the pandemic hit, the country couldn't supply itself with oxygen. That really cost lives. And so, in spite of seemingly the best efforts of the executive, the outcome was a massive spread of the pandemic. Peru was, in fact, the hardest hit country in the world in terms of per capita losses. Over 220,000 deaths as of last year in a country with a population of 34 million, 3 times the number of people who died in the internal conflict of the 1980s and 1990s. I could go on and talk about failures with regard to testing and contact tracing, the scandal over vaccines, and so forth. But I'm going to turn the floor back to Marcilia to wrap up with some final observations about what we found in our paper.
Thank you, Max, again. So our study shows that poor outcomes occurred in both cases, but for similar and different reasons. The greater preparedness of the Brazilian health system could have led to a swift response under a leadership different from Bolsonaro's. He was able to put himself as an opponent of governors, members of Congress, and even with his own ministers. He fostered fragmentation, divisions, and polarization within society. And in Peru, we saw the fragility of the health system impressed leaders with the need for a more energetic central government response. So we had focused on leadership not only as a reflection of the personality or ideology, but also as a contingent on strategic goals and institutional capacity. The centralized Peruvian response is explained not only by its unitary constitution, but also by the need of the executive to assume decision-make authority in front of the absence of alternative actors. By contrast, in Brazil, the critical role that states, governments, and municipalities played here in the response to the first wave reflect the abdication of presidential authority and also the capacity of the subnational unities to act or even replace the president response. So our findings reinforce that state capacity matters. Institutional factors alone wouldn't have predict Brazil's response. And the work highlights the importance of politics and institutions to understanding the responses, both. So despite the differences in the two cases, both attract attention to the costly legacies and negative impact of policies that weaken the government's role in supplying public goods. In Brazil, considerable investments in the health system, public health system, were undermined by a leader who valued the economy over the health and safety of the public. In contrast, in Peru, after decades of the neglect of healthcare system, it was required a vigorous response to the pandemic. The Peruvian case also reminds us that without investment in public health care and efforts to provide essential public goods, such as sanitary conditions and transportation, even a country with a strong economy and relevant leadership can suffer the worst impacts of a pandemic like the COVID-19. Thank you so much.
Thanks so much, Marx and Marcilia, for your presentation. Now I'm going to turn to Matthew Lawrenson and his work for our collection. Thank you.
Thank you, Thomas. Pleasure to be here. So I'm a professor at UAM Iztapalapa, Universidad Autónoma Universidad Autónoma Metropolitana in Mexico City. And my paper for the special issue is titled Gendered Economic Impacts of the COVID-19 Pandemic and Rural Women's Livelihood Strategies in Mexico's Mixteca Alta. Mixteca Alta is a region in the state of Oaxaca in southern Mexico. The paper was written with a PhD student, Fatima Martinez, and a colleague from UNAM, Quetzalcoatl Orozco. And so before talking about the case study in the Mixteca Alta, it's important to briefly note that there's a growing literature on the social and economic impacts of the COVID pandemic, specifically on women and rural women. And this literature has focused on three main impacts. The first is the expansion of violence against women and girls during the lockdowns. The second is the increased household workload, largely because of school closures, which mainly affected mothers. The third impact studied in the literature concerns women's economic activities. So the idea here is that women tend to work in the sectors of the economy that were most affected by lockdowns. So occupations in small-scale trade and the service sector, especially. And also the literature points out that the impacts on rural women were especially harsh for several reasons. The lack of access to public and private services and infrastructure, the lack of access to land that women suffer, so the lack of access to means of livelihoods, fewer job opportunities for women, more vulnerability in the labor market, and unstable and informal economic activities that are widespread in rural areas and that affect women more than men. Although there's this growing literature, there's at least since the last time we revised the literature, we noticed that very little attention has been paid to the livelihood strategies that women implemented during the pandemic. So there's a lot written about the impacts of the pandemic, but very little written about the strategies that rural women implemented during the pandemic to face these impacts. So our study area consists of 2 municipalities in the Mixteca Alta region in the state of Oaxaca. The Mixteca Alta is a largely indigenous, rural and mountainous region. One of the municipalities is called Yanhuitlán, which is has a population of about 1,600 people. It is a relatively prosperous municipality. It's located in the valley. It's well connected. And the other municipality is very close by, but it's it's very different. It's up in the mountain, it's very poor, it's not well connected. So this permitted us to make comparisons between two different municipalities with different economic situations. Our research was based essentially on semi-structured interviews with informants from Tonaltepec and Yahuitlán, the two municipalities. And as for the results, first, it's important to note that the economic impacts of the pandemic were different according to gender. So the impacts on men were much less than the impacts on women. That's because the economic activities predominantly by men did not experience much change during the pandemic. These activities include agriculture, tending to farm animals, and construction work. On the contrary, the economic activities most affected by the pandemic were those carried out predominantly by women. So that's the case of, for example, women who make artisanal products like pottery, women who sell food for tourists, women who work at restaurants, at a gastronomic market, at 3 small hotels in Yahuitlán. Domestic workers who are all women, women's cooperatives that sell food and drink at schools. Also, the cancellation of community festivities like patron saint festivals also affected women because they are the ones who sell food and drink during the festivities. Handicrafts, as I said. So most of the economic activities that were impacted were predominantly carried out by women. And crucially, we discovered that women did not reluctantly accept this situation. They implemented a series of strategies to attempt to maintain their livelihoods. And we divided these livelihood strategies in 3 groups. One was the increased use of local natural resources. So, for example, women gathered more firework to avoid having to buy gas for cooking. Instead of buying vegetables at the nearby city of Nochistlán, they gathered wild food products like nopal cactus, agave cactus, flowers, mushrooms, leafy green vegetables called quelites. Also, some implemented small-scale farming strategies in backyard gardens, like they started vegetable gardens. They raised more backyard animals such as chickens, turkeys, rabbits. And a third group of strategies were small-scale trade strategies. So some women started selling their surplus vegetables and animal products to their neighbors. Some bought fruit and vegetables in bulk in the city of Nochistlán to sell them door to door to their neighbors. Some women they sold food products made at home to their neighborhood, to their neighbors, tamales, tortillas, handmade tortillas, soup, tacos, etc. And interestingly, they use social media to market these products. So they used a Facebook page in Yahuitlán and WhatsApp groups, which was very important to announce their products and sell them to their neighbors. So the overall picture, to conclude, it's important to note that, well, first we confirmed that the economic activities that were most affected by the pandemic were those carried out by women. So we confirmed what's known in the literature. And secondly, we showed that it is crucial not to overlook the agency of women. So women did not necessarily resort to negative coping strategies, selling off their capital. They implemented a series of livelihood strategies, namely increased use of local natural resources, small-scale farming, and small-scale trade at the local level. So the main takeaway, I guess, against what is noted in the literature is that during the pandemic in poor rural regions, we can't think that the main strategy was a negative coping strategy of selling off capital. There was an agency carried out by women, including various livelihood strategies that may not have returned to that may not have let them return to the situation before the pandemic, but it was a livelihood strategy that let them not sell off their capital. That's the main takeaway. Thank you.
Thanks so much, Matthew. Now we turn to Alexandra and Andrea, and we'll be talking about Uruguay and the tourist industry. Thank you.
Muchas gracias. Si me permiten, prefiero hablar en español, si están de acuerdo y es posible. Bueno, muchas gracias por la invitación. En primer lugar, presentar la inquietud. Nuestro paper trabajó el tema del turismo en la pandemia y en Uruguay. Y ya que hay varios estudiantes, nos parece importante contar la motivación que hay detrás y por qué lo hace interesante el paper en una revista sobre la pandemia a nivel global. El primer...
¿Querés que te vaya traduciendo o preferís que resuma al final de tu presentación?
Capaz que, André, lo que vos digas, ¿qué preferís?
Sí, Andrea.
Tomás, ibas a decir algo, perdón.
No, vos, Andrea, sí, decime.
No sé, lo que prefieran, no sé cuántos hispanoparlantes hay en sala.
Hay algunos, pero de diferentes niveles.
Y de repente presentamos y después hacemos una traducción.
Perfecto. Hacemos un resumen.
Bien, si querés igual, Andrés, como vos quieras, después si querés me echar en inglés. A mí me es más fluido hablar en español. Bueno, lo que quería comentar en primer lugar es que estudiar el turismo en Uruguay y desde nuestra disciplina, que es la ciencia política, lo hizo interesante porque a nivel académico, en las investigaciones en ciencia política y de arenas de política pública, el turismo no es estudiado en Uruguay. A diferencia de otros países en donde podemos encontrar un vasto recorrido académico en torno a este tipo de política, como la política de turismo, encontramos que en la ciencia política uruguaya no es una política que se dé en estudio y de manera relevante en la agenda académica. En ese sentido tiene una paradoja. ¿Cuál es la paradoja? Bueno, justamente que el turismo como tal, como actividad económica, es una de las más importantes, es la que deja más divisas en la economía uruguaya. Sin embargo, desde la economía política y desde la ciencia política no la estudiamos. Cuando decimos que no la estudiamos es que no estamos trabajando y viendo la hechura de la política pública, cómo se laudan los conflictos, cómo se dan las arenas tanto de cooperación como los distintos meollos que hacen a la política pública en sí. Por tanto, Uruguay es interesante para estudiar, para investigar. Tanto es así que también a nivel de los actores, cuando miramos la política y lo que generó la pandemia, encontramos que hay una gran divergencia entre los actores y entre los grupos de presión. La manera en la que se genera la acción colectiva de los empresarios es muy distinta a la de los trabajadores. ¿Y por qué hago este señalamiento y que luego Andrea lo va a puntualizar y a profundizar? Porque uno, si mira la historia sindical uruguaya, encuentra que hay una acción colectiva y es un grupo de presión y es un movimiento sindical muy fortalecido hace más de 50 años. Sin embargo, cuando miramos puntualmente la política de turismo, encontramos que los trabajadores de este sector están muy pocos organizados, tienen grandes problemas de acción colectiva y por tanto también genera un tema de interés de investigar, bueno, ¿qué sucede frente a una coyuntura crítica? Porque la pandemia fue una coyuntura crítica, en una actividad que es la que deja más dinero en la economía uruguaya, Uruguay, un país muy pequeño, bueno, ¿cómo es la reacción de trabajadores y empresarios? Y ahí, en ese vínculo que se da entre gobierno, empresarios y sindicatos, se genera un vacío a nivel de la ciencia política y que nos generó a nosotras un interés por estudiarlo. Ese es como a nivel marco que nos resultaba importante marcar el por qué decidimos también escribir un paper sobre el turismo en Uruguay. Uruguay, que está en el top 10 de las mejores democracias de América Latina, que tiene un Estado que no presenta grandes problemas en términos, por ejemplo, de corrupción, clientelismo, por supuesto que lo hay, pero a diferencia de la región, siempre estamos en los mejores lugares, tanto como es el Estado y su funcionamiento, como en la democracia. Pero al mismo tiempo se nos presentó una coyuntura crítica a nivel mundial que nos dejó varias interrogantes. Y en esas interrogantes es que se fue desarrollando nuestro paper, analizando, por un lado, la propia política, pero por mayor medida y como a nivel más ponderado de análisis, ese vínculo entre los actores, donde además tuvo la particularidad que no es menor, que es al comienzo de la pandemia se dio un cambio de gobierno luego de 15 años de gobierno de izquierda. Esto también lo hizo interesante. Bueno, es un gobierno nuevo de centro-derecha que a los 10 días de asumir comienza una pandemia en donde se cierran las fronteras, se cierra la economía, y en ese sentido también es, bueno, cuáles son las políticas llevadas adelante por un nuevo gobierno después de 15 años de gobierno de izquierda. Y ahí justamente es que podemos analizar también lo que deja el Estado uruguayo, lo que deja, perdón, el gobierno de izquierda, el Frente Amplio, durante 15 años. ¿Por qué? Porque tenemos muchos casos en la región que justamente lo que encontramos es que cuando hay un nuevo gobierno, casi que hay una refundación del Estado, es como comenzar de cero. Bueno, el Estado uruguayo, la política uruguaya, si hay algo que mostró también con la pandemia, es que no fue refundacional. Y que muchas de las explicaciones y del argumento para entender cómo se laudó y cómo se fueron llevando adelante los distintos problemas que hubo detrás de la política de turismo, tuvo que ver con un Estado uruguayo sumamente fortalecido por una matriz de protección social y por un lugar que viene de larga data y que obviamente el cambio de gobierno no fue un problema también en ese sentido. Entonces, en ese contexto le voy a dar paso a André para ir hablando y analizando nuestro argumento y las distintas cosas que fuimos hallando para este paper. Muchas gracias.
Muchas gracias, Alexandra. Bueno, como comentaba mi coautora, el caso uruguayo Uruguay es un país muy pequeño que no suele generar demasiada atención, pero nos parecía que la particularidad de la pandemia nos daba pie para analizar, como decía Alexandra, este tema que no es muy abordado en la ciencia política local. Y como ella planteaba, Uruguay declara la emergencia sanitaria el 13 de marzo, apenas 2 semanas después de haber comenzado un nuevo gobierno de centro-derecha liderado por el presidente Luis Lacalle Pou, en el cual, bueno, se nos planteaban estas incertidumbres, ¿no? El gobierno de izquierda anterior, liderado por el Frente Amplio durante 3 gobiernos con mayorías parlamentarias, había tenido mucha afinidad con el movimiento sindical, con independencia, pero con mucha hermandad. Uruguay tiene una tradición muy larga, desde los años 60, de unificación del movimiento sindical. Hay un único sindicato que se llama PIT-CNT, que es muy fuerte. Y bueno, esos lazos de hermandad que se mantuvieron con el gobierno de izquierda, obviamente planteaban un escenario muy diferente a partir del inicio del gobierno de centro-derecha, que históricamente han tenido mucha más afinidad con los sectores empresariales. Entonces, en el marco de esta gran crisis que fue el coronavirus, el nuevo gobierno se instala y el rubro turístico, que como planteaba Alexandra, es muy importante en el país, genera muchas divisas a nivel nacional. Bueno, el turismo se queda sin turistas, las fronteras se cierran, Uruguay no tuvo un confinamiento obligatorio, el gobierno apeló a lo que llamó la libertad responsable, es decir, exhortar a la población a que se quedara en casa. Sí, los institutos de educación cerraron, se pasó a la enseñanza virtual, buena parte del funcionariado público comenzó a trabajar en casa, hubo una apelación a quedarse en casa y después en su burbuja, es decir, esto varió en las diferentes etapas de la pandemia, pero no se cerraron las fronteras, no hubo una cuarentena obligatoria como en otros países. Aún así, el turismo, por supuesto, se quedó sin turistas. Entonces, lo que vimos fue, quisimos trabajar en el paper en 2 ejes, el de cooperación y el de conflicto. Por un lado, lo que vimos fue que hubo una gran cooperación entre el gobierno y los sectores empresariales. Nosotros, sobre todo, entrevistamos actores tanto de nivel sindical como a nivel empresarial, como actores de gobierno, y vinculados en la Cámara Uruguaya de Turismo. Bueno, nos comentaba la presidenta de la Cámara Uruguaya de Turismo que hubo una línea directa con el gobierno, hubo mucha comunicación, el gobierno hizo renuncias fiscales, exoneró de agua, de luz, es decir, hizo varias, subsidió en buena medida al sector empresarial para tratar de reflotarlo, para que no se hundiera, porque efectivamente venía para larga la situación en la cual no iban a poder tener mayores ingresos. ¿Qué pasó a nivel empresarial? Entonces hubo una cooperación muy fluida, un lazo realmente fuerte entre los empresarios y el gobierno. Por supuesto, el sector empresarial del turismo, como decía Alexandra, es muy diverso. No es lo mismo una gran agencia de viaje que otros más pequeños, pero más allá de esa diversidad, en general hubo una muy buena sintonía y una muy buena aceptación desde el empresariado con respecto a las medidas que el gobierno tomó para tratar de paliar su situación. ¿Qué pasó a nivel de los trabajadores? Bueno, en contraste con esta larga trayectoria sindical unificada en Uruguay, los trabajadores del turismo no tienen experiencia de acción colectiva. Y se funda en medio de la pandemia un sindicato turístico, de agentes de viaje fundamentalmente y de guías turísticos, que tenían muy buenos ingresos previo a la pandemia, pero muchos de esos ingresos venían no por el lado de la seguridad social, sino que en realidad tenían una parte, sí, en la seguridad social y otra parte que no aportaba. Entonces, claro, en ese sentido se quedaron sin buena parte de sus ingresos. Allí lo que sucedió es que se forma un sindicato, pero con muy baja capacidad de movilización. Y si bien se forma el sindicato en el marco del PIT-CNT, no tienen esa capacidad de protesta y el conflicto permanece bajo, por más que su situación es muy, muy dramática, porque sus ingresos se ven reducidos o a cero o a la mitad, en ese marco está. Los trabajadores del turismo se ven muy relegados, pero no tienen esa capacidad de protesta y de organización. Eso también contrasta en un marco en el que en plena pandemia el PIT-CNT, por ejemplo, estaba juntando firmas para derogar una ley del gobierno, una ley ómnibus que el gobierno había promovido al iniciar su periodo por otros motivos. O sea que había movilización sindical, se estaban juntando firmas en plena pandemia. Sin embargo, estos trabajadores no logran activarse y tampoco logran, digamos, que el conflicto estalle, por más que son de los trabajadores más perjudicados por la pandemia. Entonces, nos interesó mucho este eje de cooperación y conflicto, cooperación con los empresarios y muy bajo conflicto con los trabajadores. Y también con las ideas más de la economía política, ¿no? Ya de larga data, la idea del poder instrumental y el poder estructural, ¿no? Hay un poder estructural claro que se despliega por parte del empresariado, con una sintonía además muy importante con el gobierno, y hay una falta de poder instrumental por parte, digamos, también despliegan su poder instrumental, y por otra parte tenemos dilemas de acción colectiva muy potentes en el rubro de los trabajadores. Eso con respecto al relacionamiento, al vínculo gobierno y trabajadores y gobierno y empresarios. Luego lo que vimos es, como decía Alexandra, para cerrar un poco, es que el gobierno apeló a medidas heterodoxas, ¿no? Es decir, no dejó que se desplomaran tampoco los trabajadores. Las medidas de los trabajadores fueron insatisfechas. Los empresarios dicen, bueno, siempre se puede hacer más, pero en realidad acogieron de buena forma las políticas implementadas por el gobierno. Los trabajadores dicen fueron insuficientes, pero de todas formas no estalló un conflicto realmente de relevancia para nada, pero también ayudó mucho que el sistema de seguridad social y el sistema sanitario ayudaron a que esa población no se desplomara, porque bueno, la seguridad social permitió tener subsidios por desempleo para los trabajadores y a su vez el sistema sanitario permitió que el sistema de vacunación, que si bien las vacunas llegaron tarde a Uruguay en el marco de la región, bastante tarde, dado que Uruguay tiene un sistema nacional integrado de salud consolidado y una larga trayectoria de vacunación, es decir, hay una institucionalidad bien importante, bueno, eso también permitió de alguna forma contener a la población más vulnerable. Entonces, por ese lado, el Estado también funcionó, a pesar de que las demandas fueron insatisfechas y que los trabajadores del turismo se vieron muy, muy fuertemente afectados. De alguna manera, el conflicto no estalló y la tónica fue más de cooperación. Entonces, nos pareció interesante eso, ver cómo este grupo de trabajadores que se organizan en el marco de una coyuntura crítica, bueno, cómo a partir de entonces logran instalar sus demandas y cómo el gobierno de alguna forma logra paliar esa situación. Ahora estamos un poco cerrando en año electoral en Uruguay y el gobierno, según las encuestas, no renovaría su mandato. Es decir, el Frente Amplio volvería al poder según las mediciones actuales. Es decir, por varios motivos, ¿no? Pero si uno piensa cuál fue el momento mejor evaluado de esta administración de centro derecha fue la administración de la pandemia. Más allá de que hubo después vaivenes, hubo después alta mortalidad en cierto momento, las vacunas llegaron tarde, eso generó rispideces, pero si no miramos la foto, sino que miramos la película, el mejor momento del gobierno increíblemente fue la gestión de la pandemia. Entonces, en ese sentido, es la carta de presentación. Y nos parecía bien importante eso en el marco de una coyuntura única como fue la pandemia, y creemos que después de este paper nos interesa mucho poder seguir analizando cómo estos trabajadores van a organizarse de aquí en más en el futuro, que sigue planteando muchos desafíos para un sindicato todavía muy débil. Así que bueno, agradecemos la oportunidad y también agradecemos la publicación porque nos animó a estudiar unos temas que entendemos que están muy verdes y que necesitan más reflexión.
Gracias, Alexandra y Andrea. Thank you. I'll attempt to summarize some of the key ideas in your presentation. As Andrea and Alexandra argue in the presentation, the tourist industry in Uruguay is a bit understudied in academia. And that's surprising since it's one of the most important industries in the country. As both our presenters said, it brings a lot of currency, which is very important for countries in the Southern Cone. An influx of money, in particular dollars, are always welcome in these economies. So they focus on trying to understand what happened in this moment of crisis as COVID-19 hit Uruguay, and there were no tourists. Although Uruguay has a long tradition of protecting their population through vaccination campaigns, they were obviously unable to keep the industry going through the COVID-19 pandemic. One of the goals of the research project was to study the different competing forces around the tourist industry, the business sector, the public sector, which is very strong, has traditionally been very strong in Uruguay, and the tourist workers. Uruguay also, as Andrea and Alexandra point out, has a very long tradition of unionization, and unions tend to be very strong, 50-year-long history. But the tourist industry was not one of the areas that were protected by union cooperation. So workers decided to fund a new union, and through this union, they attempted to seek more protection from the government in terms of jobs and also healthcare. The study also looks at this transition between left-wing government and a right-wing government that happened at the same time as the pandemic, or just a few days later. This transition happened just a few days later after the pandemic started, which is really interesting. And left-wing government left a long legacy too of protection to the population through public work and public services. So this transition was particularly interesting in the case of Uruguay. Traditionally, some countries in the Southern Cone go through this period of refounding of the state. This executive power is very strong, so it's able to pass all these new laws very quickly and change sort of the dynamics, structural dynamics of the economy. But during the pandemic, that was not quite the case, in particular in regards to the tourist industry. There was a lot of cooperation between the government and parts of this industry and this economic sector, sometimes through the business part of it, sometimes through workers. And that led to ways to tackle the challenges of the pandemic. According to their study, the state actually played an important role and was able to protect some jobs and the health of the workers. And most of Uruguayans see the actions of the government of Lacalle as quite successful, although it looks like in the next election they might not win. And that it's maybe a topic for another discussion, but I hope I summarized more or less the key points of your presentation correctly. If I'm wrong, if you want to add anything else, Andrea, Alexandra.
clarísimo, Tomás. Solo dos puntualizaciones que llaman la atención para dejar para comentarios. Debe ser de los pocos gobiernos en la región que la luna de miel del gobierno en pandemia duró 2 años. Y que se haya creado un sindicato durante la pandemia, o sea, me parecen nos parecen 2 hitos que realmente signan también a lo que hizo el tema de la gestión de la pandemia en Uruguay. Yo creo que no se debe encontrar en otro país de la región que una luna de miel de un gobierno haya durado tanto, sino por el contrario, generó incluso perder elecciones, grandes manifestaciones, no hubo protestas, o sea, no tuvimos protestas fuertes en Uruguay. Me parece que hay ciertos temas que hacen a la conflictividad social que fueron muy, muy minimizados aquí.
Yeah, two key points that make Uruguay somewhat of an exceptional country to study under the tensions and conflicts of the pandemic is that the elected government that took office just a few days after the pandemic started had a really long honeymoon, meant that people didn't really criticize the government for about 2 years. And that is one of the only countries also where a union was created during the pandemic. And also there were no large protests against the policies that the government adopted during the pandemic. Our last presenter is John Lust. John, do you want to take over? Thank you so much.
Okay. Good day. I'm Jan Lust. I'm Dutch, but I'm living in Peru for the last 2 decades. So, my article is about the Peruvian state and COVID-19. No? And part on Peru is already being discussed by 2 other presentators. And in some sense, I think they're correct. In some sense, we have to ask a little bit more deeper. No? Peru was one of the most affected countries by COVID-19. We ranked 6th on the world scale with COVID deaths. No? Mortality rates, we were number 1. So the question asked, why is that? It's only because we didn't invest in healthcare. Why did the state didn't invest in healthcare? Let's understand why did the state, why we didn't produce oxygen sufficiently? Why did the state not intervene in the production of medicines? Why did the state not take care, not listen to the warnings of the World Healthcare institutions, which said that you have to increase your oxygen supplies? They already said it in March. The Peruvian state did not care. The question is why they did not care. Other point is, there were dramatic things, of course. The people died in wheelchairs in car parks of the hospitals. No? People died in queues waiting for oxygen. And people, their families died also. No? So there was nothing here. It was a drama. And when you talk about social distancing, in Peru, there was social distancing only in the, let's say, relatively rich areas, or in the case of Lima, I'm talking about Lima. When you go to the popular districts, buses are full. No social distancing. No? Unfortunately, the country was saved, the people were saved by the vaccines. If there were no vaccines, maybe everyone was dead today. Peru was not prepared for the pandemic, and you could see it. Until now, Peru is not prepared for any pandemic. Nothing has changed. That's one of the point of my article. Why did the state did not change? We have the same policies, no? The same non-investments in healthcare, with the same relatively non-access to healthcare for the majority of the population. Why is that the case? Why? Because we not only have to analyze, we interpret, we have to change it also. We have to, my article is about what are the causes and what might be a process of change. No? In this article, I say the why all those bad things happened, why many people died, why there was no investments. It all had to do with the kind of state we have in Peru. Peru is a capitalist dependent state. No? So the Peruvian state, its policies, its functions, its actions are in the end determined by the international base, by international capitalist multilateral institutions like the FMI, World Bank, international power, economic power, transnational capital, and that is in the first place, it is determined. Its actions are based, are directed at the service of those institutions and those capital groups. The state here, the state determines here the national base. The national base, the national companies have to fit, in a certain way. The function of our country has to fit the necessities of the international base, the international capital, international institutions. The base of the, we argue in this article, the base of this situation, the dependent capitalist state, is our function of Peru in the International Division of Labor. So Peru is not only an exporter of natural resources, principally, but also on kind of way an exporter of cheap labor through international processes of outsourcing or global value chains. This situation, our functions internationally, is responsible that we have in Peru an abundance, a sea of micro companies. Micro companies are companies from 1 until 7, 1 to 8 persons. First. Second, we have an abundance, a sea of auto-employed individuals. And we have, of course, 70 to 80% are informal workers. Our role in the International Division of Labor is for a big part, for a main part, responsible of this situation. In addition to our role in the International Division of Labor, we in Peru, neoliberal policies are in place since the 1990s. So micro companies do not have unions. Take care is about 90% of 80 to 90% of the population works in micro companies. There are no syndicates, there are no unions in those companies. There are no labor rights in those companies. 70% is informal. So we can say, we argue also then, our economy is divided. We can see it's divided in an advanced economy, a capitalist subsistence economy. It's not a dual economy, it's how the economy presents itself. They are interrelated. So 70 or 80% of the population labors, or the mass of the companies are what we call the capitalist subsistence economy. And 30% is allowed in the advanced economy. In the advanced economy are the big companies, are formal labor, are people with labor rights, people with income on which they can live. That advanced economy is the focus also of the state. So 70% of the population, 70% of the 80%, 90% of the companies are not of interest to our state. So this can explain why the Peruvian state has not taken action. The mass of the population who died were people working or related to micro companies. Those are manual labor. We do not have, we have a very low investments in technology. In technologies, yes, in the mining sectors, in finance, in communications, but the mass of workers work in micro companies. We do not have technological development in those companies. The state is not pushing technology development because it's not allowed to. No? So this can explain why there are so many deaths. People in micro companies, people in the informal sector, people, self-employed individuals can't stay at home. We don't have a social security system. For the majority of the people, for the small, no, let's say for the small part of the population, let's 30% who are living in the advanced economy, just like myself, no, we save sufficiently to create our own social security system, our savings. But 80% does not have that income. So when there is no social security system, well, in this COVID, you have to find your work, or you're going to die from hunger, or you're going to die from COVID. Come on, let's take a chance. So the people are going in the streets, are going to look for jobs. Marketplaces, of course, the markets are open. There are people working there, and there's no social distancing. People are working in the market are small, very small companies. It's the only way to survive. So here you got, the mass of the public is not protected because they can't be protected, or they don't need to be protected by the state. But the state does not care about those 70%, because their interests are with the 30%. No, who are living in the advanced economy. No? Big companies.
John, you have,
companies.
if you can wrap it up so we can have Q&A.
So yes, of course. So policies now are pointed to the maintain the situation of a group of people of the advanced economy that stays in the power, it stays well, and the rest, the 70%, 80% of the population, okay, do your thing. And if you die, you die, because you are not of our, you're not necessary for the operation of our economic model. That is exporting of natural resources and cheap labor. We got masses of cheap labor. We can 2 million people less. That's not of a problem, because we have about 18, 17 million people who can be replaced, because they're all workers with low skills. So 2 million dead. Well, we have got sufficient people. So it's not in their interest of the state. It's not in the interest of the transnational companies and also the big national companies. So that's what about more or less about our text, to try to find an explanation why the Peruvian state did not intervene, why we do not plan. Until now, we do not plan. Why there is a segmented role of the state in society. They take care in major cities, in major districts, but do not care in districts where the mass of the population lives. But something like that.
Thank you so much, John, for your presentation. Now we can open up for questions from students. We have 10 more minutes until the end of our webinar presentation. Christy, if you want to start with one question from your students, and then we'll see if we have more questions from students that are online. Thanks again, everyone.
Yeah, thank you, presenters, for offering just brief recaps of your extensive research, showing us how the pandemic impacted a variety of aspects of daily life in Latin America in really diverse ways. And it was so interesting to see convergences in the presentations, but also real differences in perspectives. So thank you so much. I asked students some questions that they had just based on their own experiences and thinking about Latin America, having read the introduction to this volume only. And there were some interesting ones. Maybe I'm just looking, some of them are a little bit specific, but I think maybe looking forward, Jan, your presentation was kind of projecting into the future a little bit, into the present moment as well. We had some questions around the idea of what are governments and communities doing, if anything, to ensure that, there might be a different reality going forward when, as inevitably we will, communities confront new health disasters, new potential pandemics, new emergency situations in terms of preparedness. And have we learned anything? I'm not suggesting that we're out of the COVID-19 moment, which we definitely aren't, but what has been learned? I think a lot of young people are asking these types of questions, and anybody can kind of jump in speaking to their own research if they want to.
Any of our presenters want to jump in and share your thoughts? Yes, Andrea, please.
I don't know if this is the answer, but I believe that we do need a strong state. Of course, strong civil society as well, but we do need institutions, and we need a state that is present and that has social policies, health policies, economic policies, but I think we do not need less state, but more and stronger state. That's just a thought.
Yeah, anybody else wants to share your thoughts on that question or issue, or any other that you have in mind? Max? Yeah, please.
Sure. Well, first of all, I think Jan's paper actually is really good at looking at how the election of a presidential candidate of the left did not result in significant changes in Peru. And I think that's really important because Peru is notoriously one of the few countries in the region that has not in recent years shifted left. Government of Humala, maybe a very weak example of a bit of a tilt to the left, quickly corrected, again, largely by virtue of, I think, the things that Jan rightly notes, the weakness of unions and popular organizations and the enormous pressure and power of grupos de poder económico, the powerful economic groups. So there's a lot of variation within the region in terms of the strength of civil society, its capacity to place demands on the system, the responsiveness of the system. I was really impressed by the wonderful conversation I recommended to anybody that you guys had recently with Nancy Fraser around cannibal capitalism, and her insistence that it's important not to think only about the role that the state plays in terms of the reproduction of the capacity of the system to accumulate capital, but also the social reproduction, the creation of the conditions that enable the ongoing accumulation of capital. And that involves addressing things like the capacity of the workforce to be involved in the productive process. And what's really striking about a country like Peru is, of course, the government largely abdicates those responsibilities, and the large size of the informal economy is largely a reflection that people are left to look after themselves for the most part. You see the proliferation of things like very low quality private schools, very little access to public health, lack of access to basic infrastructure. But again, these things are in part the reflection of a model of accumulation, but they're also a reflection of other characteristics of the society where we see a big contrast with, let's say, the case of Uruguay. Uruguay, small, socially homogeneous society with a relatively strong state and a tradition of citizenship, right? And that was reflected in the pandemic response. In Peru, with its long history of colonial violence and racial and ethnic divisions, we don't see the same sense that we're all in this together. The sense that there is any kind of common good shared by those who live in rural, marginal, poor areas of the country and the more affluent public in places like Lima. Maybe Marcilia can speak a bit about Brazil. Obviously, it's again a very different case, but I would just sort of suggest that it's important to take a comparative perspective on these enormously complicated problems. Thanks.
Thank you, Max. Yes, well, I just want to say that I can talk about the case of Brazil. I'm living here. So I think we are making, after all, fewer efforts. We are making less than we could. And even after the defeat of Bolsonaro in the last election, we in the Lula's re-election for the third term, I think we could make more progress than we are seeing now. And also, I do think the efforts that we have to make nowadays are actually a double effort, because after all the COVID health crisis, I don't see there is a social contract or even specific policies to avoid a new tragedy. So just one example, for instance, the percentage of population that get vaccines are in the lowest level in our history. That's almost unbelievable after all that we faced in the last years during the pandemic, especially in the presidency of Bolsonaro.
Thank you, Marcilia.
We have a couple minutes, so if I don't see student questions, maybe they're feeling a little shy, but I did want to speak to a convergence in some of the research, not just today, but in the issue overall. And that is, speaking of Nancy Fraser, women in the sectors of the informal economy were the most impacted by the pandemic. And that's not just in Latin America, but also in the US. There was 1 month where there was a statistic that 100% of all job loss were women in the United States. I mean, it was just incredible the way in which women left, right, the workforce to go into the informal, or as some feminists call it, the invisible economy of care work. So I was interested in, strategies of resilience that were discussed in this presentation, especially in rural areas. So just as we understand, how women's lives were impacted by increased care work at home, loss of jobs, and an increase in domestic violence, there is also attention that needs to be paid to women's strategies of resilience. And so I just wanted to speak to these kind of convergences, and I wonder if anybody has any thoughts on women during the pandemic. And it's okay if you don't. I just thought I would ask that question. We have a couple minutes left. Thank you.
If I could make a short comment. I was listening to their presentations and thinking of ways they were connected. And this is actually one of the conclusions of our paper, which is that the impacts of the pandemic really need an intersectional lens, because it's not just about women or indigenous people who may have been affected more. In the case of Uruguay, it's interesting that the colleagues make this distinction between workers in the tourist sectors and in the tourist sector and business people in the tourist sector who were treated completely different. In the case of Peru, this distinction between poor areas that are more indigenous was a greater informal economy versus the rich areas in Lima with better access to healthcare, better access to social distancing measures, formal jobs, better protections. And in the case of our study in the Mixteca Alta, how it was the case of women who suffered the main economic and social impacts. So in the three cases, if we apply a intersectional lens to the impacts of the pandemic, we see how a pandemic, which one would think affects all of us, it doesn't affect all of us in the same way, right? It affects certain groups of people in different ways, and some groups of people are more vulnerable than others, right? And another comment I wanted to make regarding the last question, the role of the state, we also have to pay attention to the role of local government. So in rural areas, the national government may not be present at all, or very little. And this is where local governments have played a very important role. In the case of the Mixteca, in the case of Oaxaca, where we did our study, small rural indigenous municipalities were the ones with the lowest mortality rates in practically the whole country. And this has to do a lot with the autonomy and the legitimacy of local indigenous governments in Oaxaca, who have, according to state law, they have certain autonomy and are not connected to political parties. So it's important not to just look at the national government. No, it's important to look at local governments too. That's it. Thanks.
Well, we have run out of time, but this was incredibly insightful and fun to participate in. I want to thank all of the panelists and participants for making the time to join us today. We are going to be working on turning this into a YouTube video and other social media content that we'll be distributing through our different social media pages, Facebook, Instagram, Twitter. So keep an eye out for those. And if you don't already follow us, students, on any of those platforms, please do, as well as the panelists. And I'm going to ask that the panelists just stay on for a few minutes, but students, y'all are free to go. And we can just do a short debrief before we end for the day.